Well, as far as maximum pulse is concerned, I'm actually amazed. I'm amazed to hear that this subject produced so much controversy in the Western Buteyko world. Because in Russia, every Russian practitioner uses maximum pulse, and everybody who ever visited Buteyko or Buteyko classes in Russia obviously used maximum pulse. And actually Professor Buteyko treated himself from his condition. He had a problem with high blood pressure when he was a student. That's how he discovered his method. He used maximum pulse just to stop his symptoms, and then he developed his technique. And we all know that like 5 fingers stuff, like gradual reduction of breathing by relaxation until small feel lack of air. Yeah, and that's, we always give it in first class. And Buteyko method must not be always simplified by just doing maximum pulses. That's Buteyko urged us, and we understand that. And I think you practitioners, you must understand it very clearly, of course. But not to use maximum pulses, it means just to dilute Buteyko method in a sense, or not to use the power of Buteyko method, and not to use maximum pulse, especially for serious conditions. It's just a big waste. It's something very wrong, I would say. Again, not to use maximum pulse, it's a terrible waste. It's a hole in the Buteyko method. Maybe it is possible to give good results without maximum pulse, but why not to use it? That's what I just can't understand. We need to give the patients results. Results, that's what the most important thing. Professor Buteyko would never say that maximum pulse is dangerous. Maximum pulse can't be dangerous unless, of course, you misuse it, like everything else, I guess. But the poor qualified practitioner who doesn't know what he or she is doing, that can be dangerous. Or medications can be dangerous if you use them improperly. That can be dangerous, but not maximum pulse itself. Maximum pulse is breath holding. It's increasing carbon dioxide up to the level which your body needs actually. So deep breathing is dangerous, not maximum pulse is dangerous. Increasing of carbon dioxide up to the normal, physiologically normal level can't be dangerous. That only can be beneficial. I would say that practitioners who say that maximum pulse is a mistake or should not be used, they're badly misled or even ignorant, or maybe not qualified enough to use maximum pulse. Or using maximum pulses can lead to cleansing reactions. But cleansing reactions, again, were explained by Professor Buteyko. And actually, that's the way how the body treats itself, how the body gets rid of toxins and infections. Basically, patients should be glad to get cleansing reaction. But practitioner should be able to handle it in the right way. Possibly that's the only effective way to treat serious conditions. At least as far as I know, there is no, I would say there is no Buteyko method without maximum pulses. But it's difficult to put in words what the Buteyko method is. But maximum pulse is certainly a very important part of this. Mid-80s, I would say, Professor Buteyko temporarily delete these maximum poses from his manual and told us actually, not asked us, practitioners who work there, not to use them openly at least. But that was the rather political issue. He got a lot of criticism from medical bureaucrats and doctors about these maximum pose issues. Maximum poses lead to cleansing reactions, and there was no way to explain these medical bureaucrats that it's cleansing reactions actually, or healing reactions. They took it as a deterioration of the condition. And Professor Buteyko, for the sake of approval or recognition of his method in whatever shape or form, he took away maximum poses and kept sending these papers to Moscow ministerial, and nothing came out of that anyway. And results got worse straight away. And I remember we got together with practitioners, with practitioners who went around Russia, and we did not use maximum poses in full power, and we got together first and we discussed, we had like chit chat between ourselves, something's wrong. And we got together and we came to see Professor Buteyko. And of course it's like his method and he is the man. But we complained. We just said, look, Professor, not very good actually. And you know what, like he was silent for like a few long seconds, and then he said, I know. He said, I know. Can we use it again? I said, you should. He said, don't speak about that openly. But I won't be able to explain it to medical bureaucracy. So for the sake of that, I just, you know, I took away, you know, this maximum poses stuff out of my manual and documents, you know, and then we'll get it back. And we got it back, of course. And then, as I understand what happened in middle 90s or later, that issue of this controversy about maximum poses appeared again. And I don't know why. But Buteyko method without maximum poses is sort of absurd. That's what any long-term Russian practitioner would tell you. If you ask Genina, you ask Новожилова, Людмила Новожилова, you ask Vladimir, you ask what these practitioners who stayed with Buteyko for a long time used to use his methods. And of course they did maximum poses, of course they gave maximum poses, of course maximum poses is a part of the Buteyko system.